In addition to McKinsey therapy, muscle strengthening is central to our program. Strengthening is extremely important for the muscles and surrounding structures of the back and neck. It provides improved blood supply for healing to muscles and other parts of the spine. When this happens, the structural integrity of all the components of the spine increase. This includes bone, muscle, tendons, and ligaments. Most subacute and chronic back pain sufferers have tried exercising their backs at their local gym, done sit-ups, and a variety of other things. While these activities do have some benefit, they do little, if anything, for strengthening the muscles of the lower back. Progressive exercise is only helpful if it is done with the appropriate muscles. We emphasize the importance of strengthening the low back and neck extensor muscles. When back and neck muscles are exercised, the healing process to these areas is greatly enhanced. As long as the pelvis is free to move during exercise, the larger hip and leg muscles perform the work while the low back muscles remain weak and inactive. Now watch what happens when the hip, gluteal, thigh, and leg muscles are immobilized. With the pelvis secure, the low back muscles are isolated and perform the exercise without involvement of the larger muscle groups. This is why it is so important for our patients to exercise in this unique way. Let's take a look at a side-by-side comparison of the effect of pelvic stabilization. On the left, hip function is demonstrated. Hip function does very little for muscles of the low back because, without pelvic stabilization, larger muscle groups such as the hip flexors, thighs, and hamstrings take over and perform the work, leaving low back muscles weak and inactive. On the right, lumbar function is demonstrated. Notice the difference in the lack of pelvic rotation once the pelvis is stabilized by the MedX lumbar extension machine. The low back muscles are forced to do the work without assistance of larger muscle groups. Exercise also enhances the transfer of nutrients into the disc. This keeps the disc hydrated and supplied with nutrients and water that are essential for the general well-being of the disc. Exercise of the extensor muscles also makes the vertebra stronger as well as the connective tissue such as ligaments and tendons. Strengthening the spine is important, but it's only part of what we do. Overall functional improvement is key to returning patients to normal activity. Strengthening other muscle groups that contribute to posture and functional improvement is key. Strengthening arms, legs, and core muscles form the foundation of our overall program.